Good afternoon, everybody. Today's our briefing for September the 10th, 2020. We hope everyone had a safe Labor Day. And I want to begin by just letting folks know what our numbers are today and talk a little bit about state indicators. Our director of our public health division, Dr. Davis, is going to give also some updates today. So just to start, all our information is always on the city's dashboard. We've made some changes to some of our dashboard interface, which we'll talk about today. We've had, as of today, over 11,089 residents test positive for COVID, and we've lost 230 Long Beach residents to COVID-19. Now, of course, we know that most of the cases and folks that pass away are by community transmission, not through our nursing and skilled care facilities. We know that just earlier, and it feels like just been a couple of weeks now, governors announced the new blueprint for a safer economy. That's a 4-tiered color-coded system that monitors the spread of COVID-19. Every county in California is assigned to a tier. We are in the purple tier, which is where we have been with the most widespread tier and the most, really the tiers that are most suburban areas and, most urban areas across the country, across the state have, As the second largest city in the county, we of course see the tremendous impact that's happening here and all across LA County. We also want to show, I think Kevin, we're going to show the dashboard. And as you can see, this just gives you an idea of what the new dashboard actually looks like. You can see both the Long Beach numbers on there, but just by a click of the button. You can also see things like the case rate and positivity, which are the two indicators that are being used by the state now. And you can see both the LA County number as it compares from just the last time we chatted to today, which is September the 8th. And then you can also look at just the Long Beach number specifically. So you can see how we're compared to the county as a whole, and also you can compare us to what the state goals are. Also, just want to know that our city's case rate is at 8.2 and our positivity rate is at 4.7. The overall county count, which includes Long Beach, has a case rate of 9.6 and a positivity rate of 4.3. And as you can see, we are in the red tier for testing and in the purple tier for the case rate, which lands us, of course, in the total in the purple tier. It's important to note that the numbers are lower than what we reported the previous week, so the county overall is moving in the right direction. So we are, of course, making a lot of progress across LA County and the state, and so that's a really good thing for us. Certainly no reason to stop our efforts, but important that we're moving in the right direction. I want to make sure that folks understand, and especially for our small businesses to know, that under the new state guidance, the city and our county partners cannot move any faster than the state allows, period. No exceptions. So we won't have any additional reopenings from a business perspective in weeks. And even for us to look at moving into another tier, our health officials think that for us to hit the targets, we are weeks away, and it could be 2, 3, 4 weeks from moving into any additional reopenings. And that is not just us, that's happening all across the state of California. And so it's hard to say the exact timing because we don't know. We certainly know it's not happening anytime in the next couple of weeks. And so this next upcoming week and the week after, it is going to be just trying to even get safer than we are today. We are, of course, trying to work with businesses around business grants and other ways of helping, but we also need the federal government to step up. Unlike the federal government, your city, we can't go into debt year to year. That's not the way cities operate. Only Congress and the federal government can pass huge programs to help businesses, and we need them to do that. Right now, they're at a standstill. Want to also just remind folks that there's growing evidence that suggests wearing a face mask is really one of the best ways to reduce our risk of catching COVID-19. So please continue to do so. And I also have an important announcement before I turn to Dr. Davis, and that's about the census. The census, we really have only about 20 days left to fill it out. It's not just about a population count. The census gives us money for healthcare, for schools, for projects, and grants everything from Head Start programs to special education programs for our teachers. And so please fill out your census today if you have not done so already. You can go to my2020census.gov. That's my2020census.gov. You can also call by phone at 1-844-330-2020. Residents can talk to someone or communicate in over 13 languages on these census lines. So please do your census today if you haven't done it. Long Beach, we're going to be undercounted. Almost every state's going to be undercounted, and so we really need everyone's help. And with that, I'm going to turn it over to Dr. Davis, who's going to give our further update from a health perspective. So thank you.
Thank you, Mayor. Good afternoon, everyone. Let me start by saying I hope everyone had an enjoyable Labor Day weekend, and hopefully it was you were able to celebrate safely and responsibly. Unfortunately, one of the things that we have seen in the COVID pandemic after a holiday is an uptick in infection rates some weeks after that holiday, 2 to 3 weeks. And a lot of that comes from people gathering with others outside of their household. So I encourage everyone to take extra precautions over the next few weeks. Monitor yourself closely for symptoms. Make sure you stay home if you are sick. And take advantage of testing options that are on the city's webpage at www.longbeach.gov/COVID-19. As always, it's important to maintain at least 6 feet of distance from other individuals not in your household. Wear a face covering when you're in public. Like the mayor said, new evidence is coming out that it's more important than ever. Wash your hands frequently and sanitize high-touch surfaces. And within the next few weeks, pay attention, even more attention to how you're feeling. Could you have any of the symptoms of COVID-19, which are fever and chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, or a sore throat? If you do develop any of these symptoms, it's important to stay home and self-isolate. You can arrange to get tested at one of our community testing sites. You should remain home, though, while you're sick, even if your test comes back negative. This is especially important as we move closer to flu season. So to turn to the flu, influenza or the flu and COVID-19 are both contagious viruses that cause respiratory illnesses. While the symptoms can be very similar, each illness is caused by a different type of virus. Influenza is caused by a group of viruses called influenza viruses, and COVID-19 is caused by a coronavirus. So they're in different families. Because the symptoms can be similar, it may be difficult to tell the difference between the flu or COVID-19. Both viruses spread easily from person to person who are in close contact or less than 6 feet of distance from each other through respiratory droplets that are carrying the virus. Flu and maybe also COVID-19 may also spread by touching a contaminated surface, then touching your mouth, your nose, or your eyes. Both spread easily, and each virus seems to be more contagious and have more severe outcomes in different groups of people. So young children are at higher risk of severe illness from the flu than they are from COVID-19, whereas older adults are at much more risk for severe COVID-19 illness than younger populations. However, those who are older, 65 years and older, still make up between 70 and 80% of seasonal flu deaths each year. And children can experience very severe complications from COVID-19, such as MIS-C or multisystem inflammatory syndrome in children. At the end of the day, it's important for everyone to take all necessary precautions to avoid becoming infected with either virus. For the most part, preventing infection from either COVID-19 or influenza is very similar, and taking steps to prevent one will help protect against the other. So keeping physical distance of at least 6 feet from those who you don't live with, including family members who live in different households, protects against both. Wearing a face covering whenever you're around someone within close contact. Washing your hands frequently and disinfecting high-touch surfaces often. And covering your coughs and sneezes with a tissue, and then throwing the tissue in the trash and washing your hands. If you're exhibiting symptoms of either the flu or COVID-19, it's important to stay home to avoid spreading the illness to others. So turning to the subject of flu shots, while countries around the world are working really quickly to develop a vaccine for COVID-19, the flu shot is available every year. Getting a flu shot is the most effective way to prevent the flu. The health department recommends that everyone 6 months of age and older get the flu vaccine every year to reduce the risk of both flu and COVID-19. The flu vaccine helps develop immunity and lessens the severity of flu symptoms if infection occurs. Flu shots are especially important for people at high risk for severe complications, including those who are 60 years of age and older, pregnant women, caregivers of seniors or infants, those with underlying chronic medical conditions such as diabetes, heart conditions, lung, kidney, or liver conditions, and those who are immune compromised, such as persons living with HIV or AIDS, and people who are on dialysis or receiving cancer treatment. The health department is offering access to free flu vaccinations in the coming season by hosting several community flu vaccination clinics throughout Long Beach. Our free vaccine clinics will run every Thursday and Saturday from October 1st through November 21st. We will be offering clinics at 2 of the locations where COVID-19 testing is currently offered. Thursdays will be at Vet Stadium from 3 to 6 p.m. Saturdays will be at Cabrillo High School from 10 a.m. to 1 p.m. COVID testing will still be available at Veterans the morning before the vaccination clinic, between 10 and 1, and Saturday afternoons at Cabrillo between 3 and 5. The same number of appointments will be available on these days. We won't be reducing the number of COVID tests available those days. We're using these flu clinics as practice for the mass vaccination efforts we will be putting into place once there is a vaccine available for COVID-19. It's a system that we practice every year in preparation for this type of situation. So I encourage our community to take advantage of this free way to get vaccinated this season. So now turning to the new health order protocols for K-12 schools and institutes of higher education and school-aged childcare providers. Last week, the health department issued new protocols for the city's Safer at Home order, specifically for institutes of higher education and school-aged childcare providers in an effort to limit the spread of COVID-19. So for school-aged childcare providers, childcare must be carried out in stable groups called cohorts of no more than 14 students and 2 supervising adults. Cohorts serve to minimize the number of people exposed if COVID-19 is identified in a child or youth attendee, provider, instructional support provider, or staff member of a particular cohort. Children should not change from one cohort to another. If more than one cohort of children is cared for at one facility, each group or cohort shall be in a separate room. Groups or cohorts shall not mix with each other. Child care providers shall remain solely with one cohort of children. For K-12 schools, public and private schools in Los Angeles County and the City of Long Beach remain closed to in-person instruction. However, public and private K-12 schools may provide specialized in-person services for high-needs students, such as those with individual education programs, disabilities, English language learners, and other at-risk students. Capacity will be limited to no more than 25% of maximum occupancy of a particular school. Each stable cohort or group can be no more than 14 students and 2 instructors and must not mix. Each school that decides to offer in-person specialized services must complete and adhere to the City of Long Beach reopening protocols for K-12 schools and the K-12 schools exposure management plan, which you can find on our website. I just want to clarify some of the differences between our requirements for schools and those of Greater Los Angeles County. Los Angeles County limits their cohorts to no more than 12 students and no more than 10% of the usual student body present in a school on a given day. The City of Long Beach allows up to 14 students in alignment with the state recommendations and requirements, and at a capacity of no more than 25% of the usual capacity. Los Angeles County requires the completion of a cohorting form, while we require completion and adherence to the K-12 reopening protocol and adherence to the exposure management plan, which outlines what to do if there's a positive case who's been at the school. For institutes of higher education, institutions of higher education, such as colleges and universities, may continue to offer in-person training and instruction for essential workforce for only those activities that cannot be accomplished through virtual learning. All other academic instruction must continue to be done via distance learning. For more details on these protocols, please visit the City of Long Beach's COVID-19 website. So lastly, I'm going to end on the subject of air quality. I'm sure you're aware of the wildfires burning through the region. These fires are producing heavy smoke and ash, potentially creating unhealthy conditions. I encourage everyone to take caution and avoid unnecessary activities in any area directly impacted by smoke and ash. This includes areas where you're able to see or smell smoke. Some precautions include avoiding vigorous outdoor or indoor exertion, remaining indoors as much as possible, keeping your windows and your doors closed, running your air conditioner if you have one, and using a medium or high efficiency filter, and avoiding the use of swamp coolers, whole house fans, and indoor or outdoor wood burning appliances if you're able to. For more information on air quality, visit the South Coast Air Quality Management District's website at aqmd.gov. So in closing, we're making progress as a community, and we hope to continue to see improvements in our COVID-19 data, as well as a minimal flu season. With your help, we can continue these trends. Thank you.
Thank you, Dr. Davis. Now Dr. Davis will be available to take media questions. First question is from Sebastian at the Long Beach Post. Go ahead, Sebastian.
Hi, how's it going? I just had a question concerning the smoke and the ash that some residents probably are having issues with breathing. For people who don't have access to AC or safe places with fresh air, is the city considering opening the cooling centers again at some point? Thank you.
We will continue to evaluate that. Thank you for the question. If you don't have air conditioning in your house, then it would be important to close your windows, close your doors, still stay inside. And right now, we're lucky that the temperature isn't too high, where that would be really prohibitive if the temperature were really high. So we will continue to look at cooling centers, but right now with the temperature where it is and the humidity where it is, I think we could just close the doors and close windows and just try to avoid whole house fans and swamp coolers if we're able to. Thank you.
Next question is from Haley at the Press Telegram. Go ahead, Haley.
Hi, my question is about flu season coming up. Is there any reason to believe that it may be worse this year because it will coincide with COVID-19?
So, yeah, thank you for the question. So there's a couple of things happening right now. So each flu season usually starts in the southern hemisphere, so the Australia part of the world, and through travel the flu virus migrates each season to our part of the world. And so we get a lot of our thought about what our flu season is going to look like from the Southern Hemisphere. And their flu season has proven right now to be very mild. And one of the thoughts is because the same, as I kind of went through in the update, the same precautions that people are using to prevent COVID-19 infection are serving to also prevent flu infection. So right now, our hope, we're cautiously optimistic that it's possible that we may see a mild flu season based on what our Southern Hemisphere neighbors are seeing. So that's on the positive side of things. Where I think things could be more difficult this season is because the flu virus, so they've never coexisted before here on this side of the world, the flu and COVID-19 together. And so it's difficult. We don't know right now how they're going to interact. They did see, again, in the Southern Hemisphere, that if you got a flu vaccine, you were actually less susceptible to severe COVID-19. And so the feeling, we're not sure exactly why, but the one thought is that getting infected with the flu, because it's decreasing your immune system, it's making you sick, that then could make you more likely to contract another respiratory virus such as COVID-19 and to not do as well with it if you were to become infected. So there's kind of, we'll have to kind of wait and see. I think the really important thing is to do what we can, and that is to continue to practice the precautions, the staying distant, staying home when you're sick. That's very important, whatever the respiratory virus is. Making sure you're wearing your mask, because that, they've seen for both the flu and COVID-19, prevents your droplets from infecting others. And then for the flu, because we have a vaccine, it's really important that we get our flu shot this season. More important than ever if you're 6 months of age or older. Thanks.
All right, next question is from Valerie at the Long Beach Post. Go ahead, Valerie.
Hey there. My question is about the daily case rate. Can you explain a bit how the daily case rate is calculated? It kind of seems like it doesn't align with actual number of new cases per day. For example, today you reported that there was a lower number of 49 new cases today, but the rate went up to 8.5. So is it like a rolling average, or how is that calculated?
So it is a rolling average. I'll give you what I can. So the first thing is that there's a 7-day lag. So when we see our 49 cases that we saw today doesn't correlate to a 8% average daily case rate, because the 8% or the 8 average daily case rate has a 7-day lag. So it was a week ago, if that makes sense, whereas the 49 is what were reported today. So that's one thing. And then the other thing is that it is rolling. And so it's always a 7-day lag, and it's always rolling. So you're going to see kind of those fluctuations that helps to kind of blunt the large increases and decreases you may see because of the weekend, for instance. So that's why they do it that way, so that it kind of all averages out and you get what's happening as a trend versus, what's happening on Friday compared to what's happening on Saturday.
All right, that concludes our questions. We will now move on to Spanish interpretation.
Muy buenas tardes. Gracias por acompañarnos hoy. Hoy es nuestro resumen del 10 de septiembre. Esperamos que todos hayan tenido un buen fin de semana feriado del Día del Trabajador. Esta tarde nos acompaña la doctora Davis. Empezamos hoy con las actualizaciones. También vamos a darles información sobre los indicadores estatales, pero primero vamos a compartir nuestras cifras desde hoy. Entonces, hasta la fecha, han habido más de 11,000 residentes que han dado positivo del COVID-19. Además, aproximadamente 10,243 personas se han recuperado del virus. Lamentablemente hemos perdido a 230 residentes de la ciudad de Long Beach a este virus y 146 de esas muertes se han sido asociados de centros de largo plazo y de centros de enfermería a largo plazo. Las imágenes que vieron hace unos momentos, las gráficas y las imágenes que pusimos en la pantalla, nos está demostrando que pueden ver que desde el 8 de septiembre de esta semana la tasa de casos de la ciudad estamos a 8.2% y nuestra tasa de positividad es el 4.7%. El recuento general del condado que incluye Long Beach tiene una tasa de casos de 9.6% y una tasa de positividad del 4.3%. Como vieron, estamos en el nivel rojo para probar la positividad y el nivel para los tasa de casos, lo que nos lleva al nivel que está en color morado. Es importante señalar que estos números son más bajos de los que reportamos la semana anterior, por lo que el condado en general está moviéndose en la dirección correcta. Nuestro estado depende de todo el condado de Los Ángeles, que incluye nuestra ciudad de Long Beach, y la ciudad continúa monitoreando nuestra propia tasa de positividad y la tasa de nuevos casos diariamente. Esos números diarios también están disponibles en nuestro panel, en nuestras imágenes de datos que están en nuestro sitio de web de la ciudad. Otra razón más para seguir cubriéndonos la cara. La evidencia sugiere que usar una cubierta facial mientras está en público no solo reduce el riesgo de enfermarse del COVID-19, sino que también protege a otros si están infectados. De lo último que habló el alcalde hoy, esta tarde, es que desde hoy solo quedan 20 días para completar el censo. El censo es más que un conteo de población. Esto ayuda a nuestra comunidad a recibir los fondos para hospitales y servicios de emergencia, que como hemos visto todo este año lo hemos necesitado bastante. Y resultados del censo afectan la planificación y el financiamiento de la infraestructura, incluidos los programas de planificación y construcción de carreteras, viviendas de sección 8, tránsito federal y desarrollo comunitario. Para recibir nuestra parte justa de los fondos para estos servicios importantes, necesitamos que se cuenten a todas las personas. Un conteo insuficiente de como resultado menos fondos para programas de salud como Medi-Cal, Medicare, SNAP y otros programas que ayudan a nuestra comunidad. Ahora es el momento de unirnos y hacer nuestra parte. La fecha límite para completar el censo es el 30 de septiembre. Como dijimos, tienen como 2 semanas, un poco más, 20 días. Hay 3 formas de responder al censo. Lo puede ser en el sitio de web del censo, por teléfono o por correo. Hasta hemos visto que hay también personas que van de puerta en puerta, pero tengan mucho cuidado con las preguntas que se le hacen. Pero recuerde que eso no tiene nada que ver con su estatus migratorio ni nada a eso. Sin embargo, los hogares no necesitan un código de identificación para responder al censo en línea o por teléfono. Otra vez, recordarles que pueden hacerlo en línea sobre el internet o también por teléfono si llama al 1-844-330-2020. Y hay personas que están contestando las llamadas en 13 diferentes idiomas, incluyendo español, por supuesto. Ahora, alguna de la información que nos dio la doctora Davis esta tarde es que desafortunadamente con este último fin de semana que fue feriado, anticipamos que puede haber un aumento en los números de COVID-19 como resultado de este fin de semana festivo. Normalmente vemos estos casos que suben un poco porque hay día de vacación, la gente se está reuniendo con grupos más grandes, se está reuniendo con personas que no viven en el mismo hogar. Es importante tomar precauciones adicionales durante las próximas semanas y aprovechar las opciones de prueba que se están encontrando todavía los mismos horarios alrededor de la ciudad. Como siempre, recuérdese mantenerse la distancia física de 6 pies de otras personas que no vivan en su mismo hogar. Use una cobertura facial, lávese las manos con frecuencia y siempre es muy importante desinfectar las superficies que están de alto contacto. También especialmente les pedimos que pongan mucha atención si es que tiene algunos síntomas. Recuerden que estamos viendo que las personas, y esto va cambiando porque diariamente personas nuevas están infectadas, pero sigue siendo fiebre, escalofríos, tos, falta de aire, problemas con su respiración, fatiga, a veces hasta dolores musculares o de cuerpo, dolor de cabeza, nueva pérdida del olfato, dolor de garganta. Si es así, quédese y autoaislarse, por favor. Puede hacer arreglos para hacerse una prueba, pero sin embargo, si en esa temporada usted se está sintiendo enfermo, es mejor quedarse en casa y mantenerse al tanto y notar sus síntomas. Incluso si ha ido a hacerse una prueba y le regresa el resultado negativo, pero todavía está experimentando síntomas de los que hemos platicado todos estos meses, por favor, es más importante que se quede en su casa hasta que se sienta mejor. Siguientemente vamos a transmitir al tema de la gripe, la temporada de gripe, que normalmente vemos empezando estos primeros semanas de la temporada de otoño. La influencia o gripe y el COVID-19 son virus contagiosos, pero recuerden que sí tienen síntomas similares, pero son dos diferentes virus que son de diferentes familias o por decir grupos de virus. Esa es la diferencia entre una infección, ¿verdad?, y un virus, que los virus vienen en diferentes grupos. Debido a los que síntomas pueden ser muy similares, puede ser difícil diferenciar entre la gripe que normalmente vemos y ahora este nuevo virus del COVID-19. Y recuerden que estos dos virus nunca han convivido junto al mismo tiempo. Esta es la primera vez que hemos visto esto pasar, estamos aprendiendo igualmente y viendo, poniendo mucha atención a cómo están reaccionando las personas. Ambos virus se propagan fácilmente entre personas que están en contacto cercanas, menos de 6 pies, a través de las gotitas respiratorias que transportan el virus. La gripe y quizás también el COVID-19 también se pueden transmitir al tocar una superficie contaminada y luego tocarse la boca, la nariz o los ojos. Aunque ambos se propagan fácilmente, cada virus parece más contagioso y tener resultados más severos en ciertas personas que otras. Muy similar, pero sabemos que el virus, la influencia regular, los niños pequeños tienen un riesgo mayor de contraer enfermedades graves por la influencia que por el COVID-19. Aunque sí hemos visto casos en los niños pequeños, pero vemos más casos de influencia en los niños pequeños, donde los adultos mayores tienen mucho más riesgo a contraer una enfermedad grave como COVID-19 que las poblaciones o las personas más jóvenes. Pero los adultos de 66 años o más todavía representan entre el 70 y el 80% de las muertes por la influencia estacional cada año, y los niños pueden experimentar complicaciones muy graves a causa del COVID-19. Al fin del día, es importante que todos tomen todas las precauciones necesarias para evitar infectarse con cualquier o alguno de esos dos virus. En su mayor parte, prevenir la infección del COVID-19 o influencia es muy similar, y tomar todas las medidas para prevenir ayudará a proteger a contraer cualquiera de estos dos virus. Mantenga su distancia, como dijimos, use las coberturas faciales, lavarse las manos y claro que desinfectar las superficies que tienen alto contacto con frecuencia. Recuerde que siempre cubrirse los estornudos con un pañuelo, papel, luego tirarlo a la basura, y después de tirarlo es muy importante lavarse las manos. Aunque, por supuesto, si presenta síntomas de gripe o COVID-19, debe quedarse en casa para evitar transmitir la enfermedad a otras personas. También queremos platicar un poco sobre las vacunas contra la gripe. Mientras los países de todo el mundo están trabajando rápidamente para desarrollar una vacuna del virus, el COVID-19, la vacuna contra la gripe sigue disponible a todas las personas. La vacuna contra la gripe es la forma más eficaz de prevenir la gripe. El Departamento de Salud que todas las personas a partir de los 6 meses de edad se vacunen contra la influenza para reducir el riesgo de contraer la influenza y el COVID-19. Las vacunas contra la gripe son especialmente importantes para las personas con alto riesgo de sufrir complicaciones graves a causa de la gripe, y eso se incluyen las mujeres embarazadas, las personas mayores de 60 años, cuidadores de los niños e infantes, también, claro, los que cuidan a los ancianos, aquellos con afecciones médicas crónicas subyacentes como diabetes, afección cardíaca, pulmonar o renal crónica, y aquellos que tienen un sistema inmunológico más débil que otros. El Departamento de Salud ofrece estas vacunas gratuitas con la influenza en la próxima temporada. Nuestras clínicas de vacunas gratuitas estarán disponibles todos los jueves y los sábados desde el 1 de octubre hasta el 21 de noviembre, y ofrecemos clínicas en 2 de los lugares donde actualmente estamos ofreciendo las pruebas del COVID-19. Por ejemplo, los jueves será en el Estadio Vets de 3 a 6 de la tarde, y los sábados será en la Cabrillo High School de 10 de la mañana a 1 de la tarde. Las pruebas de COVID seguirán igual, disponibles en el Estadio Vets de 10 a 1 y los sábados por la tarde en Cabrillo de 3 a 5. Habrá la misma cantidad de citas disponibles en estos días. No estamos reduciendo la cantidad de pruebas. Puedan seguir haciendo sus pruebas a todos los residentes que viven en Long Beach. Estamos utilizando estas clínicas de influenza como práctica para los esfuerzos de vacunación masiva que implementaremos a vez que haya visto una vacuna para el COVID-19. También queremos platicar un poco sobre los protocolos nuevos para los estudiantes. Queremos decirle que la semana pasada el Departamento de Salud emitió nuevos protocolos en la Orden de Salud, el hogar más seguro de la ciudad, específicamente con instituciones de educación. Para los niños más pequeños de edad escolar, el cuidado de niños debe realizarse en grupos estables o cohortes, no más de 14 niños. Los grupos de esos 14 niños es más seguro para mantener, y cada maestra que esté con cada 14 niños solamente puede estar con ese estudiante en particular. También los proveedores siempre tienen que únicamente estar con ese mismo grupo. En las escuelas públicas y privadas del grado kinder hasta el 12 pueden proporcionar servicios especializados en personas para estudiantes con necesidades elevadas, como una persona y estudiantes que tengan aquellos programas de educación individual, como se conoce en inglés, un IEP. Esos estudiantes con discapacidades, estudiantes del idioma de alto riesgo, solo se pueden limitar, y la capacidad de estos grupos solo pueden reunirse de 25% de ocupación máxima en cada escuela particular. Cada grupo estable no puede tener más de 14 estudiantes y 2 instructores, y no debe mezclarse con otros grupos. Más información va a haber en el sitio de las escuelas, pero nomás queremos también decirles que las instituciones universitarias o colegios de educación más superior también hasta ahorita deben continuar con la educación a distancia o sobre el Internet. De lo último que vamos a hablar es la calidad del aire. Por último, estamos seguros que han estado al tanto de cómo nos está afectando los fuegos que están en la región, que tener mucho cuidado, eviten actividades innecesarias en cualquier área directamente afectada por el humo y las cenizas. Esto incluye áreas donde puede oler el humo. Algunas precauciones incluyen evitar el esfuerzo vigoroso al aire libre o interiores, permanecer en el interior tanto cuanto sea posible, mantener las ventanas y puertas cerradas en su hogar, hacer funcionar su aire acondicionado si tiene uno, o usar un filtro de eficiencia media o alta, y evitar el uso de enfriadores de pantano, ventiladores para toda la casa y electrodomésticos de leña, sea de afuera o por dentro. Y para obtener más información sobre eso también puede visitar nuestra página de internet. Y claro, más estamos progresando como comunidad, y esperamos seguir viendo mejores en nuestros datos que tengan que ver con el COVID-19. Estamos al tanto con ustedes para darles la más recién información. Eso es todo para esta tarde. Muchas gracias por acompañarnos. Thank you very much for joining us today. We will see you next week.